I'm Michelle Springer. I'm a genetic counselor with the Hereditary Cancer Program here at the university, and I am one of the course directors for the symposium today. Truthfully, it has been a dream of ours for years to be able to host an event like this where we could bring our Lynch syndrome patients and families together, and we are so incredibly excited and grateful to be here.
My daughter Jacqueline, she passed away from rectal cancer when she was 23. It took her 4 years to get diagnosed. Because of her age, she was tested for Lynch syndrome, and that's how we got involved in the Lynch syndrome community. Had we known she had Lynch syndrome, it would have been caught early, and I'm pretty sure she would still be here today.
I am one of the fortunate patients of Dr. Patel that started the genetic testing before I had cancer, and because of my care, I have not had cancer. One of the most exciting things that I heard today is they might be working on a vaccine. I have 2 children, and both of them are adults now, and if there could be a vaccine, then that is something that is just so positive for me to pass along to my children and then potentially my grandchildren.
I am the youngest of 6 kids, and randomly happened to come across a genetic testing that we were thinking about doing for my husband. And he came back just fine, and I came back with Lynch syndrome. 2 years later, went in, and that's when they found stage 3. I wasn't even 45, so I wasn't even on the path for a colonoscopy before. I could have been way further advanced and wouldn't be here, so it means a lot.
My name's Cammie, and I'm here today because I am presenting on how Lynch syndrome impacts children. From the patient perspective, I'm a patient for other things. I think meeting with other people that have the same condition that you have is really powerful and really an opportunity to connect with others and to normalize how you're feeling. My next steps is 1, listening to the patients. As a provider, it's really helpful for me to learn from patients so that I can take what other people are concerned about to the other patients that I'm taking care of.
Kind of an unexpected diagnosis on both counts, the cancer and the gene mutation, but now I kind of view it as, knowledge is power. My kiddos, for example, need to be tested or have screenings more often or just pay more attention.
Basically, going to conferences like this, you get the latest and greatest information. That's the key to surviving cancer, is to catch it early when it can be cured.